So, hi everyone. Thank you for joining us today. My name is Annie Oxerart, and I'm with the Association for Fire Ecology, and we'll be hosting today's webinar. This webinar was developed earlier this year with our partners at the International Association of Wildland Fire and Pau Costa Foundation as a monthly series with the goal of creating opportunities to learn about and share information on topics that could be of interest to members of all three associations. Before we get started, I'd like to mention that we're using a Zoom meeting room, so you all have the ability to use your microphone or video. But given the size of the group, I'd like to ask you all to just make sure that your microphone's muted and your video is off during the presentation. If you have questions or comments throughout the presentation, you can add those into the chat box. Then you'll see that on your menu item there, and we'll use the chat to facilitate questions and discussion after the presentation. We're recording this webinar and it'll be posted on the organization's web pages and then all of our YouTube or Vimeo accounts. And also you should be able to enable captions if that is helpful to you. It's under the three dots that say more. If you click that, you should be able to find enable captions. Today, our presenter is Dr. Savannah Devlin, who will be talking with us about integrating public health into forest and fire management. Dr. Devlin is a postdoc scholar at the University of Washington. She is an environmental health scientist and biosocial scientist with expertise in environmental toxicology, community-based participatory research, air pollution exposure, and implementation science. So with that, I'm going to go ahead and turn it over to you, Dr. Devlin, and I'll stop sharing my screen here so you can put up your slides.
All right, thank you so much, Annie. Let's see if I can get my slides up here. All right, does everyone see that okay?
Yes, good. Looks good.
Perfect. Okay, great. Again, thank you so much for having me today. It's really exciting to be talking to this group of people. I presented at your conference a couple of years ago, so fun to be back. I have given versions of this presentation many times to different groups of people, and it always comes off a little bit differently depending on who I give it to. And I'm really excited to kind of see how different it is with this group. And I'm really going to challenge you to think outside of your discipline today. So mostly the past several times I've given this, it's been to air quality people. I'm assuming that most people in the room today are wildfire people, forestry people. And so, again, I want to challenge you to think a little bit outside of your discipline and normal silo of thought when it comes to wildland fire. So, along that train of thought, I am going to make you participate a little bit with me this morning since we have the chat enabled here. So looking at these images, which one of these resonates most with you? And go ahead and put the letter into the chat of which image, when you think about this topic of wildland fire from your perspective, whatever your discipline happens to be, which image comes to thought? And then as you're thinking about that, I want you to think about what might need to change about your perspective for you to have selected a different image. So again, we kind of have a variety here. We'll see what people think. And I know there's a lot of people in the room. We won't be able to see everything. And I'm just going to scroll through the chat. We got a lot of C's, a lot of A's and D's. I like that people are putting multiple images. Love that. But this is, a whole variety of different ways to think about wildfires. Someone's putting all. Love that. All right. Second thing I want you to put in the chat here is what is your discipline? Wildland fire is an incredibly interdisciplinary field, as I hope we all know. And again, every time I give a version of this presentation, I like to ask this question because I get brand new answers that I have never heard before. And you're on this webinar space because you're involved in wildland fire in one way or another. So how do you define your discipline? Or another way to think about that is what is your perspective when it comes to thinking about and working with wildland fire? So what perspective are you coming from? And again, I know there are over 200 people on this meeting here, but take some time to kind of scroll through the chat, see if there's people that are in your same discipline, see if there's others that you maybe wouldn't have thought to be involved with wildland fire in the first place. So as as I was saying, it's incredibly interdisciplinary. You can see that in the chat. I'm going to read out a couple of them for you here. Let's see. We have geography and geopolitics, air quality, fire safety, researcher, fire risk mitigation, technology, environmental studies, and wildland firefighter administrator. Just in those 5 that I read off, they're all completely different, coming from different perspectives, right? So for the most part, and this is, let me get back to this page here. For the most part, and this is incredibly in the broad sense, but these are 3 silos that people working in wildland fire generally into, and the perspectives that we come from when it comes to thinking about wildland fire: forest and fire management, public and human health, and air quality and regulation. Hopefully you fit into one of these boxes. If you don't, I'm very curious. Let me know what box you might fit into in the chat there. So unfortunately, because we are so siloed, these perspectives often have led to an unintentionally adversarial relationship between the forest and fire managers, public health professionals, and air quality regulators. All sides thinks that there needs to be trade-offs, which makes sense. That's how we get things done, is having trade-offs and compromising. But the trade-offs are very different from each of these different silos, as you all know. From a forest and restoration and resilience perspective, we need to burn more to help forests be more resilient in the face of a warming climate with increasing wildfires, and to create less smoke in the long run. Whereas from a public health perspective, we need to use other management techniques besides fire to minimize smoke and exposure for vulnerable populations. Both of these are very reasonable and intelligent and well-meaning perspectives, but this isn't a situation where everyone means well. We public health professionals, which is the background that I come from, we don't want to lose our forests to megafires, and forest and fire managers don't want people's health to be impacted by smoke. However, these perspectives taken in isolation can lead to opposing perspectives and opposite actions at times. So we had a project several years ago where we tried to bring together a group of professionals that had each of these different perspectives to really start to think about how can we come together and address this real public crisis of increasing wildland fires, increasing in frequency, severity. Our fire season is much longer than it used to be all around the world. And so how can we bring a group of people together from each of these 3 different silos and start talking, see if we can kind of start to understand what some of these trade-offs could be and move forward together as an interdisciplinary group. This manuscript is one of the many outcomes that came out of this interdisciplinary group, and a piece of the manuscript is really what I'm going to be digging into for the majority of my talk here today. So the project was funded by SNAP, or Science for Nature and People Partnerships. It was mostly guided by University of Washington and the Nature Conservancy. Those were our 2 main PIs on the group. And our group overall was called Wildfires and Health. You can look up SNAP Wildfires and Health, and you'll find a variety of different publications and presentations that came out as a result of this project. It mostly consisted of academics and decision makers from across the Western US and Canada. And while we had a global team, the goal was really to address wildland fire in the Western US and Western Canada and British Columbia. So these are the groups of people that were involved. Not all of them were authors on that paper, but probably a third. We had a third of the people that ended up being authors. So we had individuals in this group that were really representing all 3 of these aforementioned perspectives. And we spent the first several months of our working group discussing what it was that brought us all together. Obviously, wildland fire, But on a more practical level, on the things that we do and research and think about day to day, it was really the smoke from Wildland Fire that brought us together and had some sort of impact on the work that we do or the communities that we serve. So we came up with a goal that was to find common ground and to provide a transdisciplinary view of how forest and fire management, specifically prescribed and managed fire, intersects with human health through the impacts of smoke, and two, to articulate the need for a more integrated approach. The title of my presentation is Integrating Public Health into Forest and Fire Management. That's what we're really trying to do as this larger group of people is how can we all work together in an interdisciplinary way, which you will hear me say that phrase probably 10 more times during this presentation. So we have this goal, we have this smaller group within the working group that's working on this framework paper to really set the stage for this interdisciplinary movement. And when we school, we realized that each of these perspective silos had some fundamental truths, some fundamental beliefs that needed to be addressed and explained across the group. So as we worked through these, we ended up coming up with 6 consensus statements that I'm going to now talk through with you. So I'll read each of the consensus statements and then talk about some examples of how they can be applied or how we can use them to move forward. We really believe that if these consensus statements are utilized and addressed, that they could help the field move forward in a more productive way. So again, it took us a lot of time to agree on things, as you can imagine. And so I'm actually going to read the statements word for word and then go into a little description of them. So our first statement was, we recognize the need to listen to and integrate a diversity of perspectives, in particular those embodied by Indigenous peoples who have successfully used fire as an ecological tool for thousands of years. Hopefully, at this point, this one is self-explanatory. Obviously, we need to be listening to a lot of different perspectives, and especially perspectives that know a lot about fire. So we worked a lot. We had a few Indigenous peoples represented in our working group. Really, at this point, I wish we had more, but we had quite a few spin-off projects from this larger project to dig deeper into different pieces of it. And working with a tribal group in North Central Washington was one of the projects where we were working with the Confederated Tribes of the Colville Reservation to understand how their community and adjoining communities not on the reservation were impacted by and thought about smoke exposure from both prescribed burns and wildfire burning, wildfires in general. So, excuse me. Through this project, we did interviews with both people of the general public and leadership throughout this region of Washington. We conducted interviews and focus groups with community leaders, like I said, on the Confederate Tribes of the Colville Reservation and off, to really understand people's perceptions of smoke. And one of the things that we saw as a main difference between our non-tribal and our tribal participants in this project was that the tribal participants were much more action focused when it came to thinking about prescribed burning and burning in general. Some of the members' answers were, how do we get more people on burn teams? How can we bring in more money to support forest management? Whereas the non-tribal participants were much more focused on caution and preparedness. So what do we do if smoke from prescribed burn comes into our town? How do we make sure that the Forest Service is burning under the right conditions? So you can see kind of the differences there. And that was just one example of the differences we saw. Here's a quote from one of the Indigenous leaders that we interviewed. I'm getting the point across is that we have the knowledge and there's a reason why we burned and under ideal conditions so that people understand that. It was outlawed and we weren't allowed to because we wanted to suppress fire. Not us, but when the different way of thinking came. We learned that this is a fire habitat and you got to learn to live with fire and use it as a tool, use it properly, and use it under the right conditions. All right, consensus statement 2. Prescribed fires, in addition to managed fires for resource benefit, are both necessary management techniques to keep forests resilient and to lessen the negative ecological and public health impacts of wildfires. So, this is one of those fundamental truths that the forestry and fire disciplines came in with that did not immediately sit well with the public health folks. So, as someone who did her PhD dissertation on the respiratory health effects of air pollution, this didn't sit super well with me at the beginning either. There were a lot of misconceptions about how other types of management could be just as effective as burning, and that really needed to be broken down. This happened through many group and one-on-one conversations and realizing that this was not something that was going to go away. And through these conversations, we were able to break it down and come to this consensus among everybody. And going through the takeaways with our co-authors after the paper had been published, this was one of the things that the public health folks said that they learned the most about. That management was not going to be effective without more smoke and without more fire. So I think hopefully in more rooms across the world, it's very clear, the science is very clear that by restoring the natural role of frequent and low intensity in fire in our dry forests, using tools like ecological thinning and prescribed fire, we can dramatically improve the outcomes for wildfires that we know will burn. However, people concerned with just forest management are not usually as concerned about human health impacts, but we know that smoke is one of the primary ways that people are impacted by fire. But again, prescribed fire is an essential tool. Prescribed fire has been practiced for many hundreds of thousands of years by indigenous peoples. And the benefits of using prescribed fire, they're becoming more and more widely acknowledged, which is great. There's also work to make this process, to make burning more effective and transparent through efforts such as this Eastern Washington 20-year forest health plan. This one in particular, while there's many like it, this one was released in 2017 for Eastern Washington and has a goal of burning or treating 1,250,000 acres by 2037, which is about 63,000 acres per year. Well, there's no official numbers. The Western United States projects a 30 to 50% increase in prescribed acreage burned over the next 5 years. All right, moving on to consensus statement 3 here. Certain regions of the Western US will experience more smoke days with heightened use of prescribed and managed fire. However, we expect the impacts of smoke exposure to be reduced over the long term in comparison with untreated land burned by wildfires. With these techniques, exposure in affected communities can be planned and lessened. So yes, increasing burning, doing more prescribed and managed burning will increase smoke days in certain regions. However, we agree that prescribed and managed burns will lead to less severe and less frequent wildfires and thus less smoke from these wildfires in the long run. So the last part of this statement, that exposure can be planned and lessened, really speaks to the impact that if the community is willing to work together to really make this happen. There's lots of examples about how at various levels we can prepare for smoke and how people are currently dealing with air quality regulations across different types of air pollution. But when it comes to smoke, we need a little bit more work to figure out how we can prepare communities, how we can really work towards smoke readiness. In Oregon, there is a first of its kind community response plan, which has been developed and set out in rules in cities such as Ashland, Baker City, and Bend. And these are collaboratively developed plans that they involve fire managers, air quality regulators, public health professionals, fire departments, and local officials. And they put in place needed mechanisms to share real-time information about smoke exposure and prescribed burns in the area so that community members can be in the loop and prepare themselves. On the community engagement side of things, these are some of the pieces that you may have seen putting up fire departments putting up Facebook posts to say this is a prescribed burn that's happening. I just the other day saw one of these road signs in my home community that a prescribed burn was happening. You could see smoke off in the distance. or getting even more on the go alerts, or there's certain communities that are having their community members sign up for texts. So coming up with this type of plan is how we prepare communities for smoke exposure. And then there's those second steps of, okay, what do we do when the smoke exposure comes in? So statement 4 is kind of coming from the other side of things. No degree of smoke exposure is without risk. However, additional investment in advanced preparation for affected populations can lower associated health risks. A smoke resilient community is resilient to smoke from any type of fire. So similar to my comments from the second statement, this was one of those fundamental truths that came from the public health folks that was conversely very difficult to accept for some of the forest and fire collaborators. I was at a conference several years ago where a colleague made a statement that people just need to get used to the smell of smoke. And our SNAP collaboration, bringing together these different disciplines, has really highlighted that this type of dismissive comment about getting used to smoke is really counterproductive and misguided. We've coined the phrase good fire, and that has been really helpful in certain communities. But the phrase good smoke is something that really needs to be removed from our vocabulary. So wildfire smoke is a wide range of things. One of the major components of wildfire smoke is particulate matter. I'm sure the majority of people here have seen this image in the bottom right here that shows the different size fractions of particulate matter. PM is the solid and liquid fraction of air pollution, and it's the majority of what we see in wildfire smoke. We know through many toxicological studies that particulate matter is toxic to respiratory health, and that's dependent on the size of the particles. So combustion particles, burned particles are the smaller particles, and they get further down into your lungs and can actually translocate to other parts of the body as well, doing damage to not just the respiratory system, but the cardiovascular system, the reproductive system, and the brain as well. This is one of my favorite kind of very simple breakdowns of the health effects of wildfire smoke. Kind of goes into respiratory system, cardiovascular. We also see some of the acute effects that the average Joe might feel during a wildfire smoke effect, such as coughing, difficulty breathing, irritation to the eye, nose, and throat, and then some of the longer term effects on either side here. To most communities, the increased level of smoke exposure is a relatively new phenomenon. We saw this past summer where we had smoke hitting the East Coast and nobody knew what to do. They didn't know what to expect, what to feel like health-wise when they had smoke coming through. Wildfires are not something they're accustomed to. And so the interesting thing is there's this misconception that we don't know that much about the health impacts of smoke when we really do. We know a lot about the health impacts of air pollution. Wildfire smoke is another version of air pollution, and we can learn a lot. We can glean a lot from what we know about particulate matter into the health impacts of wildfire smoke as well. So again, there's acute effects and chronic effects, and it's really going to depend on your age, your pre-existing condition, and a couple other things I'll go into in a minute here. Our recommended practices and resources to improve the health impacts of air pollution. So one is to just have an understanding of what the air quality is to inform your daily activities. So the Air Quality Index, or AQI, using guidelines that are put out by health departments, by the EPA, that align with the air quality to take steps to protect yourself and your family and your community. Using air cleaners, purifiers, and filters. This is incredibly helpful, and it's an easy way to make indoor air a safe space for people during wildfire smoke events or prescribed fire smoke events. And then use of masks. We've all gotten pretty used to using masks over the past several years. Using an N95 mask is actually quite protective against PM 2.5. So the first recommendations that I had up there were having to do with understanding what your air quality is. So the Air Quality Index is a great risk communication tool as far as getting people to understand what their air quality is and what steps they can take based on that. But there's a ton of other tools that have come out. The EPA Fire and Smoke Map will actually show where the smoke plume is across the United States. It gives not only EPA regulated monitors, but there's also some low-cost monitors that are included in here as well to kind of expand the amount of data that is accessible. there's certain parts of the United States and across the world that have no access to air quality data. And this is a place where we really could grow in the field as far as getting people more access to air quality data. This is just an example of the United States AQI and correlating health recommendations that go with it. I use this a lot with teaching students and getting them to think about what different colors correlate to and what level they might fit into as far as being a sensitive group or not. I also mentioned air filters. Air filters can be incredibly helpful when it comes to cleaning indoor air. Going inside is one of the main recommendations when air quality outside is bad, but it's not going to be helpful if your indoor air is also dirty. There's three general types of cleaners and filters. Using ozone-producing or anionic air cleaners is not helpful. Ozone is also a toxic air pollutant. So putting more ozone into your house, even if you're getting rid of particulate matter, not particularly helpful. So make sure that your air cleaner is not an ionic air cleaner. Habit filters or making sure that your filtration system, your ducts have the highest MERV rating would be incredibly helpful, especially for commercial buildings. And then these great box fan filters, which have been really helpful in more rural areas of the US, people that maybe don't have really fancy filtration systems, but have been shown to be incredibly effective when turned on to reduce pollution in a room. All right, moving on to consensus statement 5. We must work to promote both equity in process, who has a say in decision making, and equity in outcomes, who gets exposed to the smoke, within those communities and populations experiencing disproportionate impacts from smoke. So, some of the populations that would be experiencing disproportionate impacts could be those that have pre existing conditions, those that don't have access to clean indoor air, or those that have to be outside, such as the farm worker in this picture here. Something that I think is important about this statement is really thinking about who is in the room making decisions for these people, and are the people that are impacted, is there someone representing them? Oh, we need to reach community members that may not have access to the traditional channels of information, such as rural areas without internet, or people that speak English as a second language, or as a second language wherever you are in the world. One of our other spin-off projects from this project was talking about risk communication to farm workers in North Central Washington, and I'll go into those details in just a minute here. So, during a large smoke event or a small smoke event, exposure is going to impact everyone. However, just as other air pollutants, smoke does not impact everyone equally. So exposure sensitivity is what we usually think of when we say air pollution doesn't impact people equally. So where you live, what your health is, where you work, what your age is. Air pollution impacts the youngest and the oldest parts of the population worse. But people in the middle can be just as impacted, especially if they have a lower adaptive capacity. So adaptive capacity takes things into consideration such as wealth, education. Do you have the money to buy an air cleaner? Do you have the knowledge to know that putting together a box fan filter will be really helpful in your room? Do you have housing that is well sealed? Do you have an air conditioning unit in the summertime so that when it's really hot, you don't have to open the windows if it's also smoky? You have transportation that has clean air within the transportation to get you somewhere. And then are you taking the behavioral steps to actually protect yourself and your family from air pollution, such as putting on a mask? So lots of different ways to think about both of these, but we really have to combine people's exposure sensitivity and adaptive capacity in order to understand what the risk of smoke exposure is really going to be. As I mentioned, we had a project with farm workers in North Central Washington where we interviewed farm workers and their families to understand how they are impacted by smoke exposure. All of the workers that we talked to were Spanish speaking. And these are some of the takeaways from this project that we learned. One of the big ones is that communication around smoke, as well as preparation for wildfire events themselves, is really, really inconsistent across work sites. So if people are even getting information about the air quality, some people will have that on their work sites, some people won't. Some people will be given masks by their work site, and some people were only given masks during COVID, and then it's the same masks given for COVID, those surgical masks, which are not going to protect you from wildfire smoke. Another thing that we learned during this study was that in-person sharing of information was incredibly appreciated. You can see these two pictures on the right here where we had town hall events where we brought the farm worker parents together to the room to discuss what health effects were, to talk to them about how they're impacted by smoke and fire. And we had some people stand up at the end when we were doing share back that said, you know, any information we get about wildfire smoke is written down on a pamphlet, it's posted on a bulletin board. More likely than not, it's in English. So, one, we don't speak English, and two, there's a varying range of literacy across farm workers and across just rural populations in general. And so, being able to discuss out loud orally in person rather than being asked to read something that you're not going to understand was incredibly helpful. Something else we learned is that evacuation notices and smoke information is not widely shared across this farm worker population. Evacuation notices only go out in English in a lot of the United States. And also, smoke information is not what the health effects are or what steps you are allowed to take or not as far as smoke on the work site. Is the communication is just incredibly lacking. Um, Emergency notifications on air quality need to be improved. This is generally kind of across the board, not just for farm workers, but if air quality gets to an unhealthy level, some notice that goes out to tell the community, right? And so it's up to community members to take that step to look at the AQI. And so what can we do to really better prepare people when the smoke event is going to be worse? A couple of quotes from those farm workers that I wanted to share with you all. It's very, very, very hot. They do stop the harvest or they stop the activity because they say it's too much, it's too hot. Or when it's very cold, they also stop work, just like when it's hot, and they follow those rules. But when it comes to fires, which goes directly to the lung and damages it, it can affect your performance if you don't breathe well. I haven't seen them stop the activity. Teach us, like through a workshop or somehow share information in the community. Like when the smoke and fire season is coming, what measures should we take? More information, because the truth is, they don't tell us anything. The final and, in my opinion, most important consensus statement of them all. We are missing opportunities for positive impact by working as separate disciplines. We recommend that further and intentional integration of forest, fire, and health disciplines, including the practitioners, tools, and resources, needs to occur to lessen the human health effects of smoke exposure due to prescribed and managed fires. So, to further this work, after we had published this paper and kind of brought everyone together as this group of academics and decision makers, policy makers, we decided that we needed to talk to the on the ground people as well. We had come up with these great consensus statements, but were they even applicable to the people on the ground doing smoke and fire management, talking to public health professionals? And so we brought together a group of these on the ground practitioners to have these conversations, see if they're even talking to each other. And at the beginning of the workshop, we had presentations led by local community workers and people talking about smoke, people talking about public health, people talking about air quality. We had a speaker for each of those silos that were local to the community. And at the beginning, there was actually some tension that arose between a community health worker and a forestry manager, as far as thinking some of the things that they had said were a bit hypocritical across. And throughout the day, we really worked to break down the barriers, to refine those common goals within this community, and demonstrate each of these 6 consensus statements in practice. And I'm happy to report that by the end of the day, these two were sitting next to each other at the same table, discussing how they could work together in the lead up to the fire season. So we have hope that this is possible, right? We know that more can be accomplished. We just need to figure out how to start making it happen. So what we asked during this engagement workshop was, what big idea do you want to see happen? Where do you want this field to move? So long-lasting collaborative partnerships was one of them, and a need for a foundation of trust among participants. More robust communication groups for public outreach and education, more use of prescribed burns, bigger program resources, and larger outreach on the prescribed fire benefits. And smoke-ready communities was one that was shared across the group, creating new organizations, state level with communications experts, project managers, consultants, etc., to provide community support and smoke action plans, and have this be interagency funded. So, wildfires are an interdisciplinary crisis that really need an interdisciplinary solution. Hopefully, I have convinced you of this throughout this presentation here. And if not, let me know. We can talk further. So, of wildfire. It's something that I think about a lot in my day to day. And most people that are impacted by fire and smoke are not just impacted in their health, but in many different ways. So we know that wildfires can be incredibly destructive to property. So property damage or destruction is a big thing that comes along with wildfire. Economic loss in general. If you're not able to work because of wildfire, or if you lose your home or lose your job site, this is something that happens pretty regularly during wildfire seasons now. Health effects, I talked a lot about that already. And then air pollution in a community in general. There's certain communities across the world that during their fire season will go months at a time not seeing a clear day, not seeing the sun. The community that we were working with in North Central Washington talked about having the end of June through the beginning of October where they did not have a clear blue sky day. You can imagine the multiple impacts that may have on people, have on kids not being able to go outside, have on your mental health, not being able to see the sun because of fire for that many days in a row. So I recently was giving a talk to a group of individuals from across the United States, and I think a couple international people there as well, and did a survey to try and understand if people feel prepared for wildfire season. And we found that they don't. We found that almost half feel unprepared, and less than 40% gave a definitive yes as far as communities if they feel prepared for smoke season. So this means prepared for smoke from any type of fire. So wildfire, managed fire, prescribed fire, they're not ready. So what can we do to help this? Come up with a list based on this paper and based on many, many conversations and presentations across over the last several years. First thing is improved and increased risk communication for at-risk populations. So remember that at-risk population is a combination of vulnerable plus those with lessened adaptive capacity. To provide space and resources for community members that might need it. Community air shelters, improved access to N95 masks, or air filters and cleaners from the community. For workers, this is huge. This is a big, big part of our population that is not able to protect themselves from the impacts of wildfire smoke during wildfire season, which for a lot of outdoor workers is when they have to be most outside. So what can we do to protect this population? Collaboration across fields and between local groups. That engagement workshop I talked about, a big part of it was just getting people to get to know people in their community. So does the public health office know who is actually setting the burns, and are they communicating across these local districts? Not really yet. So we're hoping to improve this communication and collaboration. Improved funding for research at the intersection of human health and forest health. We talked a lot about how we are usually siloed into forest and fire, public health and human health, and air quality. It's that way in funding as well. There's many, many funding announcements that go out about wildland fire smoke that is just for forestry people, just for health people, just for air quality people. We can make the most difference, as that 6 consensus statement said, by working together. So can we incentivize funders to incentivize us to work together as well? What kinds of mechanisms can we hope to get out that would help us in bringing everyone together? All right, address and mitigate increasingly frequent and severe wildfires. We're working on this, right? But doing more and more to talk about the benefits of prescribed fire so that communities are not feeling adversarial towards them, figuring out ways that we can combine different mitigation techniques to really move this along as the best that we can. And then acknowledging and emphasizing that there's no level of good smoke. Again, we need to remove that from our vocabulary. Good fire is great, good smoke, not so much. So I want you all to think about the discipline that you originally identified with at the beginning. And I want to challenge you to think outside of this silo and identify one way that you can work outside your discipline to move the broader field of wildland fire along and jointly improve forest health, human health, and air quality. So I know we're probably putting questions in the chat, but take a minute, and I'm going to give you a minute before I move on to my question slide to really think about this. Think about what silo you fit into. Think about someone, maybe it's a collaborator or someone you've been meaning to reach out to in one of these different silos. And how could you potentially work together to improve this field of improving wildland fire, lessening wildfires in general, to improve forest health, public health, and air quality? Give it a second. And then again, I just want to thank you all for having me here. And I'm very excited about further discussing these types of things with you in the room. Happy to answer any questions. And I did put my contact information below if anyone would like to reach out to speak further. Thanks so much.
Great. Thank you so much, Dr. Devlin. That was an excellent presentation. It's already sparked lots of discussion and some questions in the chat. Let me scan back up here and maybe we can start addressing some of the questions. And everyone, please go ahead and if you have questions, we have about 15 minutes, a little more than 15 minutes left. So we'll try to get to as many of them as we can here. All right. So here's a question from Douglas, referring back to your number 3 recommendation. If your if number 3 premise turns out to be incorrect and large-scale application of prescribed fire actually leads to a net total increase in smoke exposure, how does that affect your conclusions? And then Douglas has included a resource there that might from rewilding.org. So I don't know if you're scanning back up, Dr. Devlin, into the chat, but that might help.
I'm trying to scan up here, see what we can find. Thank you for sharing the resource. So I think one of the things that we had to address within this interdisciplinary group was that the timelines of our change are incredibly different coming from the health perspective and the forestry perspective. So when forestry people were talking about change, they were talking about over the next hundreds of years. Whereas in public health, when we talk about change, we talk about hours, days, and weeks. And so figuring out how to kind of align those timelines as far as change goes is really hard. And we've definitely, there's data on both sides. There's a lot of data about the success of prescribed burning. But yeah, I'm curious to look at your resource and see there. And I think one of the things that we learned is that it needs to be kind of a combination effort of burning plus other mitigation techniques, and that's going to be the best way to move forward. And so I think that our conclusion would remain the same, that we need to continue to figure out the best ways to mitigate fire and continue to prepare our communities to deal with whatever this mitigation strategy may be.
Great, thank you. All right, Magda would be interested in the response to the recommendations among First Nations and remote communities.
Yeah, so that was one of the reasons that we did these spin-off projects, was to really kind of ask people what they thought if this was possible. And it was difficult at times. I think that people are one of the challenges that came up a lot is that people are under-resourced, especially in rural communities. So, and especially during COVID, this study happened during 2020 through 2022. And so the public, we didn't get a lot of response from public health officials because they weren't thinking about fire. They were thinking about COVID. And so having the capacity to really engage in an effective way across disciplines at the community level, people were finding hard. And so that, I think, is one of the biggest challenges, is how can we improve capacity for this types of things for practitioners, not just us kind of talking up in the ether about all of this. But other recommendations, I think, were taken relatively well. We had some of those same kind of barriers we needed to break down, as far as talking about good smoke or talking about burning in general. But there, as far as from the tribal perspectives, obviously there was a lot more interest in doing more burning there, which was great to hear, and a lot of interest, which I was grateful for, a lot of interest around improving communications and education around each of these things. There's really a lack of education, and especially in rural communities, one, about fire mitigation in general, but two, about the health impacts. People don't know what to look for when it comes to the health impacts of smoke exposure and the health impacts of smoke exposure combined with other things, right? Usually in these rural communities, you'll have smoke exposure plus heat. So how is that impacting the community? Thinking about kind of the bigger picture is hard, but exciting to be able to be moving it forward in that direction.
Then Brenda Roberts had mentioned an example of the First Nations communities taking an extra step to bring in air scrubbers to help the elderly and people impacted by smoke in an attempt to keep from evacuations. So just a comment on that. And Amy Christensen's pointing out that relatedly, Amy Christensen was pointing out that there can be good smoke, and that Indigenous nations do use smoke to fumigate certain trees, and a different look there at how smoke might be viewed, by other communities.
Yeah, no, we definitely got that from talking to Indigenous peoples quite a bit, is kind of talking about the health benefits of smoke. And so kind of having those conversations with Indigenous peoples who have been using smoke in that way for so many years, and the medical professionals who don't want to think about smoke in that way at all. And so one of the things we are trying to do is foster those types of conversations, and figuring out what the trade-offs might be from those perspectives as well. And we're still working on that.
Great. All right, I'm going to scan down a little bit more. Sarah's wondering if the class was in Spanish. I think that might be referring to the work with the
farm workers. Yes, everything was in Spanish.
Okay, let me move down here and see what, I know we're getting lots of questions down, so I'm going to scan down a little bit. All right, we have a question here from Sam. Do you have any thoughts on One Health methodology?
So I think that's one way to take this, and I think there's a lot of people actually working from the One Health perspective, thinking about wildfire. So thinking about animal health, forest health, human health in general, kind of combining them all. And I think that this would be a really good place to apply One Health, actually, as far as fires go. And when we actually taught, we had an event where we had people storyboard out how they're impacted during a wildfire event. And so many different types of health came into that, as far as thinking about their farmland, thinking about their forest, thinking about their livestock. And so I think I have not done a lot of that, but I think that would be a great approach to thinking more about wildland fire, definitely.
Linda, yes, we're going to post this recording. It'll be on the AFI website, but then also the IAWF and the Pau Costa website. And there's a lot of great information people are adding in the chat. So we'll also just include a little text file, not maybe of the full chat, but some of the resources that people have pointed out. Dr. Devlin Eleanor is wondering what sort of distinctions the SNAP work make between pre, during, and post-fire impacts.
We need to be prepared for all three of them, which I think was a huge thing that we took away from, is that there's kind of in this lead up to fire season, the people that are directly involved with wildfire are thinking about it. Community doesn't want to think about it before the first smoke hits. And so we really have been trying to continually emphasize that smoke readiness and fire readiness is a year-round thing, especially as our fire season gets longer. But we're going to be most prepared for smoke and for fire if it's something that we think about year round. And like I said, a lot of community members don't want to think about it year round because there is, and I see a question further down, is stress is a health effect. And just kind of the onset of smoke can cause a lot of mental health stress for people. And so having to think about that preparedness is difficult for a lot of communities. And so we're stressing that there isn't really, as far as preparedness goes, there shouldn't be a pre, during, and post. It should be kind of all inclusive. But there's obviously different steps that you need to take for each stage of that timeline as well.
Nicole is wondering if you would like to speak to the research you're currently conducting. If there's anything you would like to mention.
So right now I'm working on a smoke and heat communication project where we have groups of various health districts and community-based organizations that somehow address communication and messaging around the impacts of climate. So we're thinking wildfires, fire, smoke, and heat, the three things we're concentrating on, and trying to get all these different entities that are doing communication to their respective communities to think about best practices. So what are the best ways to reach farm workers? What are the best ways to communicate about vulnerabilities to heat and smoke? And then how do we most effectively do outreach and engagement in communities? So that's one of the things I'm working on. Also working on an air quality monitoring project in schools where I'm attempting to make schools as a clean air space in communities. That's where kids spend the majority of their time. And so if we can make schools have clean indoor air and have higher education when it comes to the impacts of air quality, I think that can have ripple effects out into the community. So I'm having students actually put in their own air quality monitoring networks in schools in order to address air quality from smoke and from other pollutants as well.
Excellent, thank you. I'm gonna scroll down just a little bit in consideration of the time. All right, Patrick is wondering, has there been any research estimating how prescribed fire may or may not contribute to climate change as compared to forest fires?
That's a great question. Sure, there is. I don't really know. There is a lot of research about, the differences in emissions from smoke from prescribed burns versus wildfire burns. The smoke is very different, and we know actually that it has different impacts on health as well. But as far as the impacts on climate change, I would love to see some research on that. So if anyone has resources for that, someone put that in the chat for us.
And I see Kyle did post a link there from the Southeast Fire Update, North Carolina State University. So that link is there. And thanks, Kyle, for posting that. Okay, Cecil Frost has a comment here. More than 50% of all birds, plants, animals, and insects in the US are dependent on fire to restore their habitats. Fire exclusion is more important than climate change in driving the sixth extinction. And the near future must face the issue of each species' right to fire. Any really comments?
Interesting. Cool.
Thanks, and thanks, Cecil.
One of the things, I love that. And I think that is one of those perspectives that we don't usually think about, right? And so that's something that I have tried to emphasize throughout this talk, is that we need all of those different perspectives in order to move the field effectively forward, right? And so a public health professional is likely not going to think about how forest is helping the insect population, or how forest fire is helping the insect or animal populations. And so we need those types of facts. We need those types of people in the room making decisions. As I don't remember which consensus statement it is, but I think maybe 4 or 5 are talking about which decision makers are in the room. We need all these different perspectives represented in order to, yeah, protect everyone's health moving forward.
Great, thanks. Sarah is having a class for farm and forest, Sarah Jones, farm and forest workers, and would like to any resources you have in Spanish. So I can include her email to you. And then also I did see a question wondering how to contact Dr. Devlin. Her email is on the screen right now, the very bottom there. So thank you for providing that. And if you all have follow-ups, you're welcome to email directly. Meg's wondering, is there any research connecting the growing population experiencing smoke to public concern about climate change?
Yeah, I mean, so there's definitely people that are starting to look into this. This is one of the questions that we asked during those interviews and focus groups, not with farm workers, but with kind of the broader population in North Central Washington, asking how they thought about fire and smoke and how it related to climate change. And we got really varied answers. There's certain people that connect them right away, and certain people that don't want to talk about the connection between wildfires and climate change. And so, yeah, we're moving forward in that field, I'd say, is trying to get them connected. But talking about like extreme weather events, such as wildfires or a drought, that would maybe lead to a wildfire, that is in certain populations a little bit more helpful using that phrasing, talking about extreme weather. And there's people that are looking specifically at those connections there and people's perceptions of them. And if you email me, I can send you some of those papers.
Eric is asking if there's better conditions for burning that would help mitigate the health impact, and had a couple comments from attendees already on specific where specific techniques are used, and so are conditions met. Any comments on that?
There's a ton of ways that this is already regulated. I mean, as far as being able to do prescribed burning, one of the ways that it is limited is by air regulations, air quality regulations, right? So there's a ton of regulations, both on the federal, state, forest, county level, where you have to meet certain standards in order to do any type of burning. And I see a lot of people are putting this in the chat too, but yes, there are great conditions for burning. There's not so good conditions for burning. And there's a whole slew of information out about that.
Great, thanks. Yeah, lots of good comments here in the chat from attendees. So thanks everyone for participating in this. It's really fun. I think this will be our last question, just given we have 1 more minute. Douglas is wondering if you have any links that you could provide about the your work on schools that you mentioned. Schools as clean air spaces.
Then email me and
okay.
I can send something about that. Yep.
Okay, great. So we are going to, process this chat a little bit. Any information we can include in our wrap up to you, we'll do that. We will email the recording and any links that have been included here, so you all have kind of a summary of this. And then the recordings will also be posted on the Association for Fire Ecology, the International Association of Wildland Fire, and Pau Costa Foundation's websites. So thank you so much, Dr. Devlin. This has been really great. Thank you all for joining us. We had 250 people at one point, I think, so that's really exciting to see the interest in this. And we'll see you all soon.
Thanks so much. Appreciate it.
Thanks. Bye-bye.